If you've been trying to conceive for 6 months or a year, you've probably had some lab testing done at this point. And when you look at those labs, you might be looking at it thinking, am I even getting all the information out of here that I can? How do things look? My doctor maybe just gave them back and told me everything looks normal, but you really want more information. What are these tests? Why were they run? What do the results mean? And is this really as good as I could possibly be? If you have had those questions, today's video is for you. We are going to be demystifying lab testing for women when it comes to fertility. So let's dive in and get started. First of all, let's talk about what labs should be run. So typically, we want to test your hormone levels on 2 different days in your cycle. The first is cycle day 3. Now on cycle day 3, you want to have tested your estradiol, your follicle stimulating hormone, which we'll talk about as FSH, your luteinizing hormone, which is LH, your anti-Mullerian hormone, which is called AMH, and then your testosterone, both free and total, along with DHEA sulfate or DHEAS. That is your basic panel of hormones that you would have tested on cycle day 3. The second time you need to go in for blood work is 7 days after you ovulate. So for a 28-day cycle, that would be cycle day 21. And on that day, we check progesterone. That's the day that your progesterone should really be peaking. So we want to measure the peak. So you would have your blood work drawn twice during your cycle. And also the way you'd start counting is that cycle day 1 is the first day of full flow of your period. So if you spot for a day, that doesn't count. It's really just the first day of full flow where you're really needing to use like a regular pad or tampon. Then you start counting. So cycle day 3, you probably are still on your period when you have all those blood tests done. So let's talk a little bit about each of these tests, why they're tested, what those hormones are really important for, and what to look for in your result. So if you have lab tests that you've had done, I'd recommend you pause the video and grab them so that you can take a look side by side as we walk through. So the first test I want to talk about is estradiol. Estradiol is our body's main form of estrogen that we make. And you probably know that estrogen is really critical for your menstrual cycle and your reproductive health. Now, estrogen is made in high amounts in the first half of your cycle, primarily from cells in your ovaries. Now, estrogen has a couple of really important functions to get your body ready for pregnancy. The first is it helps to get follicles to mature, to be ready to have that superstar egg that can then ovulate. And actually, the eggs themselves, those follicles, once they start to develop, that's where the estrogen comes from. By the time you have what's called a dominant follicle, which is kind of like the winner that's going to ovulate, a few days before ovulation, that dominant follicle is actually making about 90% of the estrogen in your body. So they make a lot of estrogen. And the estrogen has other important downstream effects within the body. As you get ready to ovulate, a couple of changes happen. One, you make more cervical mucus. Cervical mucus, you might have noticed, can change throughout the course of your menstrual cycle, but that vaginal discharge changes specifically around the time of ovulation, where you start to make a lot more. And it looks like that kind of loose egg white consistency, I'm sure that you've read about, that egg white cervical mucus, or we also call it spin mucus. Now, this type of cervical mucus actually supports sperm swimming. And so it helps to nourish the sperm and make it easier for them to get up through your cervix into, the fallopian tubes where that egg should be waiting. So really important for estrogen to be around. The other key thing that estrogen does is that it helps to thicken the lining of your uterus. And of course, we need a nice, thick, juicy mattress for that implantation to implant into. So having enough estrogen around is critical. Now, when it comes to the lab test for estrogen, what you want is to have just enough, but not too much. If you have too much estrogen around, it actually can be a problem and can be a sign that your ovaries are not as responsive or that you have a lower ovarian reserve. So estradiol is always changing in the cycle. That's why we have to test it on cycle day 3. And when you look at the range of normal most labs put out, it might say follicular phase, which is the first half of your cycle, and read something like about 12.5 to 166. Now that is a gigantic range. So how do you know what's optimal for you? Generally for fertility, we are looking at your estradiol being between 30 and 50 picograms per milliliter. That's the unit. So 30 to 50 is really the sweet spot. Up over 50, we start to worry a little bit about ovarian reserve, and that's when we want to institute some of those naturopathic therapies to really get things on board and improve that. Okay, let's talk about the next measure, FSH, or follicle stimulating hormone. Follicle stimulating hormone is a hormone made by your brain that does exactly what it sounds like. It stimulates your follicles to grow. This is how your brain controls the menstrual process. FSH from the brain tells the ovaries it's time to make an egg, and the ovaries respond by making that egg. Now, FSH, again, we want to be in a healthy range. And I think about it a little bit like if your brain is a parent and your ovaries are the child, you want the brain to only have to whisper, not to have to raise its voice. If the ovaries aren't as responsive, that FSH starts to go up. Just like if you had a child and they didn't clean their room the first time you asked, you might start to raise your voice too. So with FSH, the normal range is between about 3.5 and 12.5, but we really ideally want to see that below 6. Okay, that would be ideal. If you were 18 years old and tested this, I'd expect to see your FSH probably around 4, 5, or 6. Okay, just that whisper. Now, as we get older, FSH does start to rise. And so for a woman who's over 35, generally I like to see below 10. But when you get up above 12 or 15, that's when we really start to be concerned that your eggs may be declining in quality. Okay, IVF clinics sometimes turn patients away when their FSH gets that high. Now that's something that we work on a lot because we can help improve the health of the ovaries and actually bring FSH down to help you become a better candidate for IVF or conceiving on your own. The next hormone that we measure is called LH, or luteinizing hormone. Now, LH is not so critical for everyday fertility analysis, but we do look at the ratio between FSH and LH. And if that starts to change, where LH is a little bit higher than FSH, and sometimes it can be 2 to 3 times higher than FSH on cycle day 3, that can actually be a sign of a condition called polycystic ovarian syndrome, or PCOS. That we just need to take a look at to make sure hormones are in good balance. The next test that we look at to assess ovarian reserve is called anti-Mullerian hormone, or AMH. Now, AMH is kind of a pooled hormone. Depending upon how many follicles you have and the health of those follicles, that number will go up. Okay, so when you're younger, you usually have higher AMH, and as you get older, it will start to decline. So when we look at the normal range for AMH, generally it's reported as between 1 and 4. However, this is stratified by age. And when we look at women's lab tests, I like to actually compare you to your peers versus comparing you to that maximum fertility 18-year-old. So what we like to see is that if you're under 30, it should be above 4, okay? If you are between about 30 and 34, we want to see above 2.4. If you are 35 to 37 years old, we want to see above 2. If you are between 38 and 40, I would like to see it above 1.5. If you're between 41 and 42, above 1. And anything over 42, our goal is always to get you at or above 1. So this kind of varies based upon your age. Hopefully you're able to jot down that target. Again, this will naturally decline with aging as you have fewer follicles and lower quality follicles. And so this is something that we just take a look at to see where you're at compared to your peers. One important thing about AMH, it is not the end all and be all. So if your AMH is not perfect, but your FSH and estradiol look good, that can be okay. Don't worry too much. The data on AMH is not totally clear. It's a bit fuzzy. So we look at AMH, but we wouldn't bet the farm on AMH, if you know what I mean. We wouldn't design a treatment plan specifically around your AMH if those other markers look good. So FSH, estradiol, and AMH are the 3 values we use to look at and to qualify your ovarian reserve, otherwise thought of as kind of your egg quality. Now, a couple other hormones we look at on cycle day 3 include your testosterone and DHEA. These are what are called androgens, and we think of them primarily as being important for men, but they're actually quite important for women as well. They are precursor hormones. They help you make a lot of other hormones, and they also can influence the health of your eggs and your ovaries. So women who have higher androgens, such as women who have PCOS, tend to actually preserve their egg quality later in life. because their androgens are a bit higher. But again, this is a situation like most hormones where you want like just enough, not too much and not too little. So for women, generally we looking for a total testosterone of 1.5 to 2.4 nanomoles per liter. If your lab uses nanograms per deciliter as its value, that equates to about between 30 and 55, okay? And then when we look at free testosterone, that's reported in picomoles per liter. And this is just, again, so you can check the units, because sometimes if I give you an answer, it makes no sense on your labs. They might be using a different unit. So for free testosterone, our goal would be between 2 and 4.2 picomoles per liter. The other androgen is DHEA. And again, actually the normal range for DHEA varies based upon your age, but regardless of your age, what we see is that you have the best fertility results when your DHEA levels are between about 180 and 300. If they're over 300, that's when I get a little worried that you might have too many androgens around. And so we want to investigate a little bit into that. Now, let's shift gears and talk about progesterone. Progesterone, again, is run on cycle day 21. And with progesterone, 7 days after ovulation, the normal range is reported as 1.8 to 24. Now, what that means is that the progesterone's high enough to confirm ovulation. Now, we can confirm ovulation generally when your progesterone's up above 6, but that's not the ideal level when you're trying to conceive. In fact, 15 to 24 is your ideal range when you're trying to conceive. We know that women who have progesterone at 15 or above tend to have better outcomes than women who are even in that 10 to 15 range, which is normal, but not optimal. Again, a reason why we look at normal versus optimal labs when it comes to more of a functional and naturopathic look. So that summarizes your basic hormonal labs that you've probably had done for your fertility. We can talk a bit more about other labs that you'd want to have tested, including testing for your thyroid, testing for important nutrients like vitamin D and others at a later date. But I hope that this helped you to really get a better understanding of these labs, why they're run, and what you really should be looking for. Because it's not just enough for your doctor to hand you back your lab test that had no red flags and say, things look normal. I know that you really want to know more than that. And really, our goal is to be in optimal health and optimal fertility, particularly when we're struggling. So hopefully this helps point you in the right direction as far as what hormones might use a little bit of a shift. I'm Dr. Jaclyn Smeaton with Hello Fertility. Hopefully you found this helpful. If you'd like more resources and information, feel free to visit us at hellofertility.com.